Instruct the patient to rest their tongue behind the tongue cup and to lightly bite down. Isolate with the 2x2 gauze included in the ZOOM kit. This gauze has been tested and is proven to provide superior protection with the ZOOM lamp. Do not substitute your own gauze for this procedure. Place the first piece of gauze fold side down in the upper vestibule, followed by gauze placed fold side down in the lower vestibule. Now place 2 face bibs around the retractor flange. Retuck the gauze into the vestibule if necessary. Open the third 2x2 piece of gauze into a 2x4 piece. While holding the ends of the gauze, roll it lengthwise to resemble a cotton roll. Align the crease with the midline and place it in the upper vestibule. It should cover approximately first molar to first molar, number 3 to number 14. Take the fourth piece of 2x2 gauze and repeat this step for the lower vestibule, covering from approximately number 30 to number 19 in the lower arch. The fifth and sixth pieces of gauze will be placed in each cheek. Fully open the gauze and fold it into a triangle. Place the apex of the triangle into the posterior cheek and tuck the end into the flange of the cheek retractor. Remove the cap and attach the tip to the Liquidam syringe. Be sure the tip is inserted fully into the recessed area of the barrel and lock it into place. A complete isolation requires 60 to 80% of a single syringe. Do not apply Liquidam more than 2 millimeters thick, or it may not cure completely. Begin by applying the dam along the gauze in the upper vestibule to form a seal. Apply to the full arch, or at minimum a single quadrant for proper coverage, manipulating and extruding the material as you go. Make a second pass along the margin, scalloping the gingival margin to ensure full coverage. Be sure to cover all interproximal areas, sealing the Liquidam to the enamel. All dentin should be covered. Cure the application of Liquidam. Liquidam is a resin blend that can become warm. Therefore, use a sweeping motion when curing, moving the light back and forth across the arch for about 10 seconds. Do not leave the light in an individual area for more than 2 seconds. On the lower arch, first apply Liquidam, scalloping the teeth at the margin to allow gravity to pull the material down towards the gauze placed in the vestibule. Again, make a second pass, sealing the isolation materials. Cure the lower arch application in a sweeping motion for 10 seconds. Once complete, use the sweeping motion again on the upper arch for 5 seconds and move back to the lower arch for an additional 5 seconds. Use the tip of the syringe to press lightly on the application to ensure it is completely cured. The material should be solid and have no give. If necessary, cure the arch again for an additional 5 seconds. Check to ensure that all soft tissue is covered and that the gingiva cannot be seen through the Liquidam. If necessary, add additional Liquidam and cure. Use saliva ejection to remove any saliva pooling in the cavity. Open the final piece of gauze and place it between the teeth, over the retractor's tongue cup. Make a final check to ensure no tissue is left uncovered. Use the motto, "No pink," as a standard. Check the interproximal areas of the application, especially on your blind side. Check the entire oral cavity to ensure all tissue is covered. Apply additional gauze or Liquidam where necessary. Section 6. Gel prep and application. Break open the end of the swab applicator at the line to release the solution into the tip. Apply one swab to the top and bottom arch. The solution does not need to dry. The whitening gel may be applied immediately. To enhance shelf life of the gel, the ZOOM whitening syringes must be refrigerated while stored. However, the gel must be returned to room temperature for use. Either remove the gel from the refrigerator the night before, allowing the gel to remain at room temperature for at least 6 hours, or place the syringe in a cup of hot tap water for 10 minutes and remove the syringe 5 minutes prior to use. Refer to the instruction manual for specific temperatures. Remove the cap by rotating a quarter turn to the right. Place the mixing tip at a quarter angle. Rotate left to lock in place. Do not apply ZOOM gel directly onto the teeth. Extrude the gel into a dappen dish or onto a mixing pad. Use the brush supplied in the kit to stir the gel and apply it to the teeth. Apply the gel to the facial area of all visible teeth, approximately 1 to 2 millimeters thick. Section 7. Begin the whitening process. Activate the main power switch located on the side of the power supply module. The dash side of the button should be pressed for the unit to be in the on position. Adjust the back of the chair to a comfortable position, approximately reclined 30 degrees. This is the easiest position for lamp placement, but adjust appropriately for patient comfort. Attach the light guide to the lamp. The lamp will not turn on if the light guide is not in place. The display will read Guide Status, Guide Attached when the light guide is attached, and will then read X of X sessions, press Start. The number of sessions can vary based on the kit type. The light guide is designed to ensure proper distance to the light and maintain light exposure to the smile zone. Slide the lamp into place next to the patient. Position the lamp head to the patient's smile zone, aligning the slots on the light guide with the retractor. Place the end of the retractor into the slots located on either side of the light guide. Press the Start button on the display panel to turn on the light and activate the timer. It will begin the 15-minute countdown. It is normal for the light to flicker for the first few seconds. Be sure to check on the patient regularly during this period. If you plan to leave the room for an extended time, provide the patient with a means to contact you, such as a small bell. It is also helpful to have a paper and pencil available in case the patient needs a means of communication. Point out to the patient that the progress of each session will be tracked by 4 lights on the top of the lamp head. A light will appear for each 25% of the session. These lights are also helpful for checking on the patient's progress and time remaining.